So as far as the NEET PG August 2025 recall is concerned, we are just going through the analysis, and we have seen that there are a large chunk of questions which have been asked from the subjects like anatomy, naturally, from subjects like surgery, and from subjects like medicine, including derma and psychiatry, as well as a good chunk of questions from microbiology, pharmacology, and pathology. So we can see over here, these are the major subjects, but we cannot underestimate the minor subjects like ortho, optho, ENT, physiology, dermatology, anesthesiology. So let's go and see what the questions were asked. And as far as the NEET PG August recall is concerned, I have gone through the set of questions earlier, and now I will be going through other set of questions. So basically, I will be going not through the options, I will be going through the basic crux of the questions which have been asked over there. And so you are well aware that one of the questions asked was demyelination syndrome. So demyelination syndrome, you may be given a clinical scenario of a condition like multiple sclerosis, in which you can be having demyelinating plaques, and the choices mentioned must be CT, MRI, PET, and say, for example, radiograph, any other option. But you have to remember, for demyelination syndromes, the best choice of investigation is the magnetic resonance imaging of the brain, especially. So demyelination in the CNS I am talking about. So that's important. Now there was another question about COVID, the treatment of COVID, and a person in respiratory distress, and what would be your ventilation strategy be. So you have to remember that we should ensure that the patients who are having this acute distress, especially in case of COVID, we have a low tidal volume plus positive EEP, I mean to say PEP high and low tidal volume. That is the basic crux of treating patients once we have a patient with PaO2 and FiO2 of the 100. So it is very important how you treat the patient in respiratory embarrassment situations. So for that, you have to have a combined knowledge of anesthesiology and medicine as well. Now, a patient presented with irregular pulse without comorbidity, and the drug which you will be given, about the choices mentioned were, and the answer would be verapamil. You are well aware of the calcium channel blockers, and verapamil is one drug which is given in such conditions. Now, then another question was a patient who had a craving for the salt plus hyperkalemia plus metabolic acidosis plus pigmentation. And I will be coming at the end of the class through going rapidly through these things. And you are well aware that Addison's disease is one disease which is characterized by a combination of pigmentation, I mean to say hyperpigmentation, with increased potassium, serum potassium levels, low sodium levels, and metabolic acidosis plus salt craving. Now, patient presented to you with acute stroke with right-sided weakness, normal BP though, and the CT does not reveal any bleeding. So it is not a hemorrhagic stroke. That's very, very important. And the next step would be so important. Once you have a patient with an acute cerebrovascular accident, and it's not a hemorrhagic type, so you can assume for all practical purposes it is an infarct, and the next step will be thrombolysis. So thrombolysis forms the cornerstone in such cases. Then a patient with anti-CCP and positivity with morning stiffness, and I am well aware of the fact that this is a simple case of rheumatoid arthritis, and anti-CCP is positive, and the pathological entity, I have emphasized it a lot many times. I will be going through the slide in the end. So PANUS formation is a classical pathological feature of rheumatoid arthritis. Addison's disease was the confirmatory test by now, because you read this Cushing's disease, Addison's disease, you read these acromegaly syndromes, you read cretinism, you read hypothyroidism, you read hyperthyroidism, and for that you have to remember that Addison's disease, the confirmatory test is ACTS stimulation test. Then from anesthesiology, we get these one-liners, and I will not focus much on the types of questions, because anesthesia is a specialization, and you are asked the basic facts about these muscle relaxants with maximum histamine release. And I have already emphasized in my books, Platinum Cure Bank and NEET PGQR, that atricurium is one important muscle relaxant, which has got a huge histamine release. So that's very important. Malignant hyperthermia, since the days I have grown, this question has been asked. Then it was asked in between, and now it's asked to the new generation as well. So malignant hyperthermia, drug of choice, dantrolene, and so many questions you get about malignant hyperthermia. So we will be discussing that in detail. Now, this question from psychiatry: boy lost his father a few weeks back, and he's having flashbacks. So, what type of disorder is it? There was one thing which was post-traumatic stress disorder, and there is something which is acute traumatic stress disorder. So, it becomes an acute stress disorder. So, you have to remember the difference between a long delayed stress disorder and an acute disorder. So, this falls within the category of acute stress disorder. Now, a person who would be a perfectionist and who would be just having a personality, I mean to say, what type of a personality it is: narcissistic, histrionic, obsessive compulsive. So rightly the answer to this question would be obsessive. A person who would just be very much say, for example, repeatedly washing his hands, thinking that his hands contaminated, and he will be going to the washroom to wash his hands once, twice, thrice, four, still not satisfied, 5 times, 6 times. So this sort of obsessive condition, obsessive compulsive neurosis. So he wants to be perfect. So that is the answer. Now, a person he has a bizarre behavior, identity loss, moving away, and what sort of a personality disorder it is? It is dissociative fugue. So you have to remember these, I mean to say, clinical conditions in psychiatry: schizoid, schizotypal, schizoform, paranoid, obsessive compulsive, it's an attention deficit hyperkinetic disorder. All these things, they are very important, and I've already focused in my book about that. Now, as far as I was going through the questions, multiple sclerosis, I told you demyelination, although I mentioned as a brain CT as a question over here. So you have to remember that multiple sclerosis, this is an addition for the new students, that multiple sclerosis is one condition which is having, I mean to say, demyelinating plaques in the brain. So with cerebral atrophy sometimes, and it shows multiple contrasting enhancing plaques. And the best modality, I've given it as a clinical scenario, and the best modality is the MRI, though here the CT was done. So, but the best modality is the MRI, not the CT. That's important. So second question, verapamil. Verapamil should be used in case of asthmatics and with patients with irregular heartbeat. So it's a calcium channel blocker, as I mentioned to you. So that's important. Addison's disease, I have given a question number 79 in my Platinum Q Bank. So I have mentioned all the features which were asked from you in the examination: hypoglycemia, hyponatremia, hyperkalemia, isn't it? So that's important. Addison's disease. Now, thrombolytic therapy, and you have to remember this drug, which might be asked in future, alfamiprase, and it is a thrombolytic agent which is given in acute cerebrovascular accidents. Anti-CCP antibodies, I just mentioned to you that it was given in a question, what is a pathological feature? And anti-CCP antibodies, they are a feature of what thing? It is the condition I mentioned, rheumatoid arthritis. So very important, rheumatoid arthritis. So important. Not only that thing, PANOS, the question which was asked to you, I have mentioned it. The PANOS, the word PANOS, remember, it's a feature of, this is second other question which I had given. Question number 55, you can see over here from Platinum Q Bank. That question has directly been taken and in a indirect manner put in there, and rheumatoid arthritis is the answer. So anti-CCP antibodies, positivity, and PANOS, rheumatoid arthritis. Atricurium, see how I have mentioned this drug over here, given the full features in my Platinum Q Bank. And one thing which was asked, release histamine in a significant amount. So histamine release is a major feature of which drug? It is the atricurium, which was mentioned over here. So that's very important. So this is something which I just wanted to emphasize upon you, what is important and what is not important. Then malignant hyperthermia, drug of choice, and it is prescribed by succinylcholine, and you know, it is a condition which is as a result of many drugs which can be administered, and then we give dantrolene as the here I mentioned it, dantrolene, it's not prescribed, dantrolene is the treatment of choice. So acute stress disorder, I have given a full scenario of what we mean by acute stress disorder, so that is important. Just the question given where the boy faced a trauma because of the loss of his father within 2 weeks. Obsessive compulsive neurosis, a boy washes his face 20 times, as I mentioned. So that is a sort of an obsessive type of condition, and what drug we give? Fluoxetine. So that's important. Now we go across to certain other questions which have been asked over here, and I will just be going through the questions which have been asked in dermatology. painful vesicular lesion plus multinucleated giant cells. I am tired of the times, I had number of times I have told this thing that it can be nothing but a viral infection, and that way herpes simplex virus. I mentioned it, I will be going through it. Vascular lesions on hands with grouped vesicles, dermatitis herpetiformis, a clinical condition. Remember it, though it is not asked frequently to you people, but it is a very pruritic condition, not usually responding to the conventional antipruritic drugs, and sometimes you have to give immunosuppressants. And it is characterized by grouped vesicles. That's important. Then hypopigmented patch since birth, maybe, but I'm not sure whether it was Wood's lamp, and the condition was an overlap between nevus pigmentosa or vitiligo. I will be just coming to that as well. Now, lupus vulgaris, you remember that, the tuberculosis of the skin. It presents usually with a chronic lesion with indurated plaque with central atrophy. It was to be identified. Now, lateral border of tongue, the swelling and an indurated ulcer along the lateral border of the tongue, and the many viruses were mentioned. And you have to remember HPV, human papilloma virus, is implicated in many carcinogenesis like the carcinoma cervix, oropharyngeal malignancies, another question which was asked, and over here along the lateral border of the tongue, because other choices were irrelevant. Oral lichen planus aggravated by beta blockers, drugs aggravating psoriasis, many drugs, and lithium was one of the answers. So you have to remember not only the drugs which are used in the treatment of certain conditions, but certain drugs which you precipitate, especially the dermatological conditions. So over here, first I will go in a reverse manner. Vitiligo. So this is the vitiligo autoimmune clinical condition characterized by hypopigmentation. Number 2, lupus vulgaris, you have to remember that was a question asked, and maybe you might be given in another examination, what are apple jelly nodules? So apple jelly nodules are characteristic of lupus vulgaris. So vitiligo I mentioned as far as the question below goes, it's a hypomelanosis condition, the question which was put to you. So this is the vitiligo, and the condition was there. Then carcinoma cervix, I have given a full type, 16, 18, and cervical cancer. But not only that, there are other types, 31, 33, 45, and 58, and many of them are associated with laryngeal and oral cancers. Lichen planus, I have given papules, 4 P's, papules, polygonal, purple, pruritic. So that's important. And the condition was which drugs precipitate. Okay. So over here, psoriasis, I have given a full condition. Remember the features of psoriasis, but the question asked to you was, what are the external factors which cause psoriasis? And it was lithium. And in here, I have highlighted it. It is the lithium over here in my book. So that is very, very, very important. Many books do not give you such types of coverage. So that's it. Zinc smear of cells. I have given a full description of herpes simplex virus. So zinc smear, it can cause keratitis, herpes labialis, keratitis I mentioned, encephalitis. So that's important, and other. But the question asked you was zinc smear and multinuclear giant cells. So that's very important. Now going to some of the questions which have been asked about the biochemistry. Alpha iduronidase deficiency leads to accumulation of which substances? So you have to remember heparin sulfate and dermatan sulfate. Important. Basal cell carcinoma with freckles, that means xeroderma pigmentosa. What type of defect is it? Nucleotide excision repair. That's very important. I have mentioned it hundreds and hundreds of times. Then scurvy and a patient presents with multiple fractures, pitched appearance of the bone, and which enzyme is deficient? Prolyl hydroxylase. We will be coming to that. So you have to remember the full features of scurvy. So scurvy can present with fractures as well. Then jaundice with bleeding corrected after vitamin K. Most probable cause is biliary obstruction, impaired biliary circulation, especially in case of neonates. Now, man trapped in tunnel for 5 days, main source of energy. So you know starvation and how the body reacts to starvation. And after a few 4 days, you know that ketone bodies form the source of, metabolism of food over there. Now, tetrahydrobiopterin, BH4, hyperphenylanemia with cofactor deficiency. Which would be the cofactor deficient in hyperphenylanemia? So you have to remember tetrahydrobiopterin. Now, vitamin B12 deficiency, no subacute degeneration of the cord, posterior columns affected. What leads to deficiency of what? It leads to the deficiency of which compound? Methionine. Now, you know beriberi, how beriberi presents. Thiamine deficiency, I mean to say, it presents with heart failure, neuropathy, nutritional deficiency of thiamine. So beriberi, you have two types, wet type, dry type. I will not go into that. Frame shift mutation. What does the frame shift mutation cause? It causes a complete change in protein sequence downstream. Why? Because it's a frame shift mutation. It's not a small mutation. So it completely changes the protein sequence over there. Now, for the person with acute bacterial meningitis, the multiplex polymerase chain reaction would be the investigation of choice to detect the cause of acute bacterial meningitis immediately. Orange tonsil disease, Tanger's disease, I have already mentioned. I will be showing it across. Then xanthomas are present in what? They are present in hyperlipoproteinemias. I will be coming to that. Infant present with that infant. It's an infant. Recurrent infections with ADA. ADA means adenosine deaminase deficiency, and you know SCID, severe combined immunodeficiency syndrome. So ADA deficiency leads to SCID, and cherry red spots plus neurodegeneration is seen in which disease? Cherry red is very important thing. Tay-Sachs disease. Bite out spots, I won't think that would bother you much. Many students cannot get it wrong. Vitamin E deficiency. So coming back to the things. So I will not go. Bite out spots, I have given a full vitamin A deficiency and even the SPM social and preventive medicine criteria for bite out spots for vitamin A deficiency. So I will not go. Now I was mentioning about cherry red spots. I will come to that. So cherry red spot is present in two conditions: Tay-Sachs disease and Niemann-Pick's disease. So there you have to remember, without hepatosplenomegaly is one important thing, and with hepatosplenomegaly is another thing. So you have to remember these things. Then the substances which are accumulated in the disease is the gangliosides. You have to remember. So you have to be very particular about what enzymes are deficient and what substances are. So I was going through this thing. See over here. Now the substances in dermatan sulfate and heparin sulfate. This was a question asked. So it is the Hurler's or the Shy syndrome in which these substances accumulate. So that's important. So we are done with the biochemistry part of it. Now, going to the part of it down. Xeroderma pigmentosa. So a question 293 from Platinum Q Bank. It's a what type of a rapier? Nucleotide X-gene rapier. I have already mentioned the question. Scurvy, not characterized by only fractures by Palcan super and pencil thin cortex. I have mentioned in my NEET PG QR book. Now, thiamine deficiency and beriberi. Now, orange tonsils. Not only that, I have given a full mention of other diseases. Thanks a lot for that. Now, xanthomas, hyperlipoproteinemias. And I have given a full description of what we mean by plantar xanthomas, what we mean by tuberous xanthomas, what we mean by tendinous xanthomas, and what we mean by eruptive xanthomas. SCID from Platinum Q Bank. My question number 117, adenosine deaminase deficiency. And what is it? SCID. Now, so this is something which you have to remember, and I think that this just sums up how we prepare for our NEET PG, what are the types of questions we expected, how we answered them, and what important books we just studied for the NEET PG Platinum and the NEET PG QR. Thanks a lot.